Good afternoon, everyone, and welcome to today's webinar on cybersecurity tips for health organisations. Whilst we wait for a few more people to join today's session, just going to run through a little bit of housekeeping. We are recording today's webinar, so you'll be able to watch a copy of this later if you would like. If we could please ask for everyone stay on mute for the duration of the presentation. If you would like to ask a question later in the session, you're welcome to unmute yourself and ask away. But just keep in mind that you may be part of the recording later on. Otherwise, you can post your questions in the chat and we can respond to them later in the presentation. I'll see if I can mute some of the participants joining in. Give me 1 second. All right, it seems that we have muted everyone, so I will keep going. Okay, so before we make a start, if we could jump on to the next slide, please. I would like to acknowledge the traditional owners of country throughout Australia and their continuing connection to land, sea, and community. I pay my respects to them and their cultures and to elders, both past, present, and emerging. So thank you to the Darling Downs and Westmoreland PHN for organising today's session. My name is Jenny Snigavaya. I'm the Acting Manager for Education at the Australian Digital Health Agency, and today I am joined by a very experienced panel of cybersecurity experts, I will say. So today's presentation will be delivered to you by Tracy Weeks. She is the Manager of Cyber Awareness and Education at the Australian Digital Health Agency. Her career spans 28 years in the state and federal government and over a decade's experience in the field of cybersecurity in the healthcare sector. And Tracy now leads her team within the cybersecurity branch at the agency. We also do have Kim Clark on the line, Lead Officer of Cyber Awareness and Education. She has over 6 years experience in the cybersecurity space, working across both private and public sectors. And she thrives at delivering people-focused cyber solutions, including awareness, education, policy and compliance to clients across government and healthcare sectors. And our last expert on the line today will be Danielle Pentony, the Director of Cybersecurity Operations, currently acting as Chief Information Security Officer at the Australian Digital Health Agency, with over 15 years experience in the technology and cybersecurity space as well. So we have lots of smart people on the line today who will educate you about all things cybersecurity and give you some tips on protecting your organizations from potential kind of cyber threats and give you tips on how to stay a bit more informed in this space. But before I do hand over to them, I thought I would just very quickly kind of set the scene for you all today and let you know about some of the things that we do here at the Australian Digital Health Agency. We are a government agency and we are responsible for improving the use of digital health services and technology in Australia. We aim to create a more connected and efficient healthcare system by providing better outcomes for patients through the delivery of some of our digital health initiatives and programs. And we are responsible for a wide range of them. For example, we are the system operator for My Health Record. We've also played a really key role in rolling out electronic prescribing across Australia. We do a lot of work with the industry to develop, promote standards for secure exchange of health information between healthcare providers and organizations as well. We support the use of telehealth services, which use digital health technology so that some of these services can be delivered remotely. And we also provide a really wide variety of education and training for healthcare providers and consumers as well, so that everybody understands how to better use our digital health technologies. Now, early in the year, we were very excited to launch our own My Health app. So it's our own mobile phone application that allows consumers to access their My Health record information conveniently on their own mobile device. So if you're on the call and you're interested in having a look at your own My Health record information, you can download our new application by searching My Health Gov in the Apple Store or the Google Play Store. It's a free mobile application, and it's really great for consumers to be able to use it on their mobile device and have access to their information, because sometimes they visit health professionals who maybe don't have easy access to My Health Record through their clinical software. So it allows them to share some of that information with their health professionals and access it themselves if they'd like to have kind of some oversight over it. So I'm very excited to announce this, but we're all here to listen about cybersecurity. So on this note, I'll hand over to our key speaker, Tracy, who'll kick off today's presentation. But like I said, if you do have any questions during today's session, please feel free to pop them in the chat and we can try to respond them after the presentation. Thank you.
Thank you so much, Jenny. And thank you, Renata, for inviting us back. We had the opportunity to speak to your PHN a little earlier this year, and we only had a short time with you then, so we're really pleased to be invited back to delve into this topic that little bit deeper. So over the next 40 minutes or so, we'll recap and expand on why we need to talk about cybersecurity. We're going to have a look at how cyber attacks eventuate, and then we're going to touch on cyber resilience and the My Health Record system security as well. And as mentioned, we do have our director, Danielle Pentony, who is with us today, and she will be available at the end of this session to assist with any questions that you might have. So digital transformation does continue to improve many aspects of our daily lives, including our healthcare outcomes. However, as digital transformation and that reliance continues for both organisations and individuals globally, the market and opportunity for cyber criminals unfortunately also increases. And this is why it's so important to talk about cybersecurity, because cyber criminals will always aim to find those weaknesses in any organisation that they can exploit through cyber attacks, through things like phishing and ransomware attacks in particular. Their motives, we know, are typically driven by financial gain. So that is that demand for ransom to release locked data, which we know as ransomware. And we need to understand that the healthcare sector really is that prime target. And an attack can lead to lots of different things. So things like our loss or theft of information, our intellectual property and our research data. It can cause significant disruptions to your service delivery. It can cause a lot of reputational damage. And one of the worst things, that loss of consumer confidence. So some of you, if you have heard this beginning this presentation before, you may know the answer to this question, but I do have a quick one for you. I want to know, and feel free to pop it in the chat, is what do you think has a higher value on the dark web? Do you think it's a sale of someone's credit card information, or do you think it's a sale of someone's healthcare record? Quick second if anyone's got any thoughts on that one. It is definitely the sale of healthcare data. Yep. Oh, someone's gone credit card, Tanya. You would think so because it's so valuable, but it is our healthcare record. So when you're looking at the dark web, we can find that healthcare records can sell for up to about $250 per record, compared to about $5.40 for a credit card or a payment card. And this is simply because of the plethora of information that sits within a healthcare record. We can quite easily cancel our credit cards and replace them, and the funds are often recovered. However, if your identity is stolen through a healthcare breach, then that has ongoing ramifications for people's lives. So I've been working in the healthcare industry for well over a decade now and been talking for a really long time about the attractiveness of healthcare data to cyber criminals. And unfortunately, we've recently seen this come to light within the last 12 months and witness a fallout from these kinds of breaches. So just a quick recap of a couple of those recent breaches of healthcare information. So the first one I'm just going to have a quick look at is back in February of last year, we had a private pathology clinic was breached where over 220,000 personal records were caught up in that particular incident. This included things like the tax file numbers of staff, it had Medicare numbers, driver's license, passports, credit card details, and the medical and health records associated with all those pathology results. And then the big one in October, we saw Medibank Private cyber attack and the subsequent data breach. So this attack actually resulted in the largest breach of personally identifiable information and sensitive health information in Australia to date. So that was over 9.7 million customer records were impacted, 200 gigabytes of diagnosis, which again include healthcare claims and personal information. And then the sad part was that information was then accessed and sold on Russian language cybercrime forums. And since that, Medicare has actually announced that part of its financial report that the breach was the result of one of its user credentials being compromised. So what this means is that cybersecurity really is absolutely everybody's responsibility. So it takes everyone in our teams to be vigilant, your staff, your colleagues, your IT teams and vendors, to ensure that the availability and the delivery of your services and the protection integrity of that information and that data entrusted you is taken care of. And ensuring that you and your team understand their responsibilities and in particular take accountability for them, because scary stat, one of the biggest risks to healthcare organizations is actually that cybersecurity is a human factor. Okay, so developing strong cybersecurity behaviors will go a long way in actually helping to prevent cyber attacks. And when a cyber attack or a data breach does occur, sadly, it really is rarely the fault of the technology that's in place. And the Office of the Australian Information Commissioner actually reported that 96% of data breaches are the result of human actions. And if we break that down, of the 96%, about 33% goes down to human error. So that's things like we accidentally send information to the wrong person or accidentally post information online. Whereas about 63% then is actually attributed to malicious attacks. So that's things like email phishing. So while this statistic can sound quite alarming, it is important to know that there are some really simple steps that you and your teams can take to start on this journey to protecting yourself and your organisation from cyber threats. So what we're going to do now is I'm actually going to hand over to Kim for a little bit, who's going to discuss how cyber attacks eventuate, and I will catch up with you guys again shortly.
Thank you, Tracy. And because 91% of all cyber attacks begin with a phishing email to an unsuspecting victim, we are going to first discuss phishing. So what is phishing? I'd be very surprised if any of us on the call today have not received a phishing email, phone call, or text message. But as a refresh to what it is, it's when cyber criminals pretend to be a known company, such as a government organization or your bank, in an attempt to trick you into completing their requests, which are generally to click on a link that will take you to a fake website and steal all the information entered, whether that's your username, password, or credit card details, or opening an attachment, such as a Word document, PDF, or other file, but in fact, it is actually a computer virus, but more commonly known as malware. So phishing attacks are often sent to thousands of people at a time. They also tend to capitalize on what is happening in the media and current events. So I have on the screen a recent phishing sample that's being circulated, and ScamWatch has actually reported that MyGov-related scams were up 160% in January this year. But with a bit of awareness training, such as you're doing today, you can start to discern that this is a scam. So now let's go through some of the warning signs. The first is that the email address is incorrect, or it's known as what's called spoofing. So you can see in this email, it appears from MyGov in the name, but the actual email address is not correct. Always check that the email address is correct before even continuing to read on an email. You can see they're using a generic greeting, dear customer, That is always a key indicator of a potentially phishing email. Unsolicited or unexpected, but this is how most people can get caught out, just because perhaps they were expecting a refund or a parcel that day. Coming into end of financial year, be wary of ATO or tax-related scams, as these will be ramping up as well. Too good to be true? Does MyGov actually send out refunds? No, they generally do not, so be sure to critically analyse the content before interacting with it. May contain spelling, formatting, or grammar errors, but experts have now leaned towards saying this is no longer an indicator of a phishing email because criminals are now using spell check or free to access or cheap to access AI tools such as ChatGTP, and we'll talk about that a bit later. Because if you look at this specific example, you'll see there aren't any spelling errors at all. And finally, there's always a malicious link or attachment to a website. And in this sample, if you clicked on the link, you would actually be taken to this phishing website, which at face value looks quite reputable, looks almost the same. But this is why your attendance here today and ongoing cyber awareness is so important. Because after today, hopefully you wouldn't have reached this stage, but if you did, I would advise you to always look at the web address. What is the URL telling you? And what is your web browser telling you? Because if you did in this case, you can see here, it is incorrect. That is not at all the MyGov site. And in fact, your web browser is telling you that it is dangerous. And you'll hear me say this a few times today. It's why it's important to keep your software up to date, because only our modern browsers or up-to-date browsers have these new features of telling us that a site is malicious. If you entered in your username and password, they'll then try and take your credit card information as well. Some recent SMS phishing samples known as smishing. So the very common themes that continue to circulate are the hi mum or hi dad, my phone is dead, I have no money, please help. Australians have already reportedly lost $7.2 million to this scam. The next is the unpaid toll scam, and these samples were actually sent to me by a friend. So if you clicked on the link, you'd be taken to this website, and she unfortunately provided not one, but 2 bank cards before she realised it was a scam and then contacted her bank right away. I also recently listened to a podcast, a finance podcast, where the host did the exact same thing, got this same scam, provided not one, but 2 cards before realising, oh, I've done the wrong thing. I wanted to discuss business email compromise, or BEC for short, which cost Australians a reported $98 million in losses last financial year, and that is an increase of around $30 million from last year's reports. So it really is impacting and affecting Australian businesses. So what is business email compromise? Compared to phishing, it's highly targeted. Phishing attacks, they're casting a wide net, whereas BEC attacks can be referred to as spear phishing. So the common types of BEC scams are CEO fraud. So the criminals pretend to be the CEO or the CFO to trick staff into taking action. Payment redirection or invoice fraud. So an organization's account may be hacked and is then used to request payments through fake invoices with different details or direct transfers. And finally, data theft. So criminals may target employees to obtain personal or sensitive information about others within the organisation, such as the CEO or executives, to then leverage for future attacks. And if you look at the sample on the left, which is a copy of an actual CEO fraud attempt, you'll see there aren't any hyperlinks or attachments like you would usually see in your phishing emails. Now, this is what's known as a social engineering tactic. They're first trying to build a bit of a relationship, cause a sense of urgency, and then the following communications will be, please go buy these gift cards, please make these purchases. Here's a bit of an anatomy of how these BEC attacks work. So first, the criminals will compromise the email and IT systems of a legitimate business. Observing transactions, they identify opportunities to divert money into their own accounts. To do this, they'll impersonate those trusted senders, vendors, either using the hacked email accounts or simply spoofing it, as we saw with phishing emails. They'll send out the email, The victim will complete the request, which is probably to pay this fraudulent invoice. And unfortunately, businesses only realise they've been caught out when it's too late, when they're chasing payment. However, customers are saying they have already paid. How do these targeted attacks eventuate? Firstly, as we just discussed, business email compromise. An individual or organisation's account is hacked. Phishing scams. So phishing is that wide bait, casting the wide net. But if someone takes the bait, they will gather those details and then continue to launch targeted campaigns to get access to that information. This is data breaches. So website data breaches such as Canva or LinkedIn, or the large scale breaches we're seeing in the media, Medibank, Optus, and recently Latitude. When these incidents occur, varying levels of personal information, including your email, usernames, sometimes passwords, are leaked online and sold to cyber criminals. So with this information, they can create those believable or targeted scams, or perhaps just brute force access your accounts. But in our activity a little later, you'll see a positive way of how these stolen databases are being used, and that is to inform people that their information has been caught up in a data breach. And finally, targeted attacks can be developed simply by gathering information that's publicly available on websites and social media. I'm being a bit ambitious, and I'm hoping to show you a quick video on just how private your information on social media can be.
Hi, Kim. Are you able to reshare your screen with audio?
Not working?
No, it doesn't seem to be coming through on my end.
This is what I meant by I was being ambitious.
Information on Damien.
Yep, I am.
Mother's maiden name is.
Oh, hi, can I help?
Hot chocolate.
What's the name?
Joelle.
What was the name?
Alex.
Alex.
Thank
There you go, Johnny.
Cheers.
If you like our Facebook page, we give you a free hot drink and a free pastry.
We have a new like for Damien. We have a new like for Damien.
Hey, Carly, are you standing by?
Standing by. Hi there, can I help?
Yeah, I just liked your Facebook page.
Okay, I'll search Facebook
I'm
now.
searching Google.
I have a phone number.
I've got his email address.
Okay, Carly, are you ready?
For information on Damien.
Yep, I am.
Mother's maiden name is. He banks with.
Carly, this is the girl coming in now with the blue scarf.
What's the name? Nicholas.
Nicola. His date of birth, 7th May. She lives at 38A.
Just be a couple of seconds.
2 children, 8, 4 and 6. Previous address. She's on the postcode.
Yep, got it. Damien, age 26 and a fitness instructor.
How do you know that?
Where did you go to UCL? Martin went to South Thames College, assistant psychologist at Great Ormond Street.
That is. I don't understand.
Oh, better.
You know I'm a Christian as well.
Oh, yeah, we know everything about you, Martin. Thank you. Nice to meet you, Anna from Russia.
Can reshare that link in case that didn't operate properly. However, social media has become a great resource for criminals to find information about their victims to create these believable scams. So please keep in mind that once you post something online, you have lost control of who has access to it and what they do with it. And it's important to regularly review your digital footprint. So simple things like making sure your profiles are private, not accepting unknown friend requests, and protecting your accounts with strong passwords and multi-factor authentication. So generative AI is dominating a lot of headlines as of late, and one you've likely heard of or used is ChatGTP. Now, while these technologies can be entertaining, they're also being used by criminals to facilitate cybercrime through things such as facilitating romance fraud through chatbots, creating fake product and service reviews on shopping scams, and the ability to create, as I mentioned, those believable fake images, videos, and voice recordings, and phishing text messages. Recently, Channel 7 did an investigation into voice cloning technologies, and the reporter actually calls their mum, and she thinks it's him at first. So I will share that YouTube link in the chat if anyone is interested as well. But a final concern I will just mention around these generative AI technologies that organizations are finding is information privacy impacts. And this is the result of users unintentionally sharing sensitive or personally identifiable information with these AI chatbots. So ChatGTP actually does have specific disclaimers to do not share sensitive information because the reason is it's generative AI. It is storing and learning from all the information that is entered. So potentially in your practices, this is something you may want to develop a policy around or just chat to your staff about so that they're aware. What a scam. Before clicking on any links or attachments or sharing personal details, think, are my emotions heightened? If it is, if you're curious or stressed, consider this a red flag. Did this message come from a legitimate sender? Remember, it may appear from your bank, government organisation, but often the actual email address will not be correct. Did my colleague or friend actually send this to me? Remember, they may be hacked. And how can you confirm? Good old-fashioned way, just by phoning them directly with details that you have sourced independently. Is this the correct website? Remember checking the URL and the web address before entering any personal details or credit card information? Does this offer sound too good to be true? If so, it likely is. And can this person confirm their identity? If they can't, do not do what they are asking and cut off communication with that person directly and contact the company yourself. We're going to discuss ransomware, which according to the Australian Cybersecurity Centre remains the most destructive cybercrime threat. And this is because it can impact everyone from everyday Australians through to entire countries. In May last year, the Costa Rican government declared a state of emergency following a ransomware attack on nearly 30 of its government institutions, including health, finance, and energy. And thankfully, Australia has not experienced an incident of this scale at one time, but the potential remains for cybercriminals to cause widespread disruption. And perhaps some of you on the call today might have yourself experienced or heard from colleagues working at other health organisations the impacts of ransomware attacks and the pressures it can place on patient care and processes. What's ransomware? It's a type of malware attack where criminals steal and lock access to the files on your device. They'll then issue a ransom demand in order for you to get the key to unlock your systems and avoid the public release of data. However, the ACSC does not advise of paying the ransom because there's no guarantee you'll regain access to your information or prevent its release. It makes you susceptible to further extortion, and paying ransom demands encourages and stimulates the economy of organised cybercrime. So ransomware and other malware attacks are the result of opening a link or attachment in a phishing email, opening those links or in smishing text messages or social media posts, downloading malicious apps or software, and visiting malicious websites. To prevent these ransomware and other malware attacks, we recommend that you, number one, install software updates. Keep your software, applications, and operating systems up to date. Never click on links in an email or a text message unless you're certain they are safe. And regularly back up your devices to ensure if an attack occurs, you will not lose all your important data. I'm now going to go through a case study, which is a cyber attack known as SEO, which stands for Search Engine Optimization Poisoning. So this attack is actively targeting the Australian healthcare sector and the legal sector. So what is happening? In a nutshell, criminals are leveraging search engine keywords such as hospital, health, medical, and enterprise agreement paired with Australian city names. They're also paying for ad space so it can appear within the first pages of results. But the highlighted boxes are the poison links, and I've retyped the web addresses so you could see where they actually take you. But how many people do you think analyze the source or website before opening it? Also, you may notice the small alerts saying this site may harm your computer. And we don't always analyze these things or scrutinize these messages, but we really need to start before we go ahead and click these links. If you did click on the first result, you would be taken to this fake blog forum. And if you read the posts, there's nothing concerning in the content. In fact, the admin's being very helpful and providing you with a link. But if you clicked on this link, you'd be taken to this enterprise agreement. However, hiding in this file is malware, which will install itself onto the device, and in the days to come, data will be stolen and likely ransomware will be deployed. However, this is again where your training becomes so essential, because you can train yourself to look up at the URL, see what your web browser is telling you before downloading or interacting with any content. This is not a new type of malware, though researchers are seeing healthcare and legal sectors being impacted by SEO poisoning. So the key takeaway is always check where a link is taking you before opening it or interacting with the site. Go to those trusted resources, official government and other organisation websites. Always check and read any notices and acknowledge those alerts. For example, that this site may harm your computer. See if that's coming up within your search results. And finally, just be aware. Inform your networks that these attacks are happening, and don't trust something just because it appears in a search engine. And on that note, I'm going to hand back over to Tracy, who will talk us through how we can protect ourselves from cyber threats.
Thank you so much, Kim. It's really important that we do look at how attacks eventuate, so we get a really good understanding of the different ways that these cyber criminals can impact our organisations. And now we're just going to take a quick look at some practical tips that you can apply to protect yourself even further. So before we start though, we gave you that stat at the beginning of the session, but let's flip that on the head. And so instead of saying that we as humans are the cause of all the breaches, it'd be great if you could start looking at like we can actually prevent 96% of breaches. And by looking and through the tips we're going to give you next is one way we can still start to work to flip that statistic around. So how can we do this? First, we're going to look at securing our online accounts. So that's things like our work accounts and even looking at your personal accounts at home. So things like your email, banking, social media. We really believe that it's important that you understand how to protect yourself at home, because if you understand how to protect your personal information, you'll bring those practices into the work environment as well. So we're going to look at things like passwords now, look at multi-factor authentication, and Kim has also touched on the security controls of your social media accounts. So let's look at the first thing. This is a website called Have I Been Pwned? Some of you may have seen this before. This is actually a fantastic tool that was developed by an Australian security researcher, Troy Hunt. However, now that ABC has actually used Troy Hunt's database to help you even further with a really graphic. So we're going to show you this website in a second. So what you can do is you can actually find out what data breaches you've been caught up in. You can actually see a visual summary of the potential scale of the leaked information that is actually out there about you, and then understand how something that we know as the mosaic effect can actually increase all the risks that we face online. So Kim's now going to enter the email address of her partner actually, because he's been caught up into a lot of breaches, and we'll just see this come together. So you can see it's actually going through and it's actually stating all the different places that the information has been put up. So there was 10 different breaches. Okay, and between them, yep, so you can see that it's information that's often being caught from breaches. So the information that's actually been put out there and all the information they've gathered up has email addresses, passwords, Kim's partner, fiance, I should say now, username, and other names and phone numbers as well. So that's a lot of information that has been caught up in the different data breaches. I have my email address was caught up in 3. So we tried to use my email address on here and it didn't give us enough information. So if you have been caught up in, you think you might have been caught up in a lot of breaches, you could try this ABC app. It's fantastic. We can put the link in the chat. Otherwise, we always suggest going back to the Have I Been Pwned website, because this actually, when you type in, I'm just going to type in my email address now. You can also very quickly see if your email address, you can also put your phone number in here as well. So when you hit pwned, oh no, I've been pwned. And as we scroll down, and feel free to play along at home, if in your office, if you're at work, you've got your computer in front of you. And if you've been caught up in any breaches, again, feel free to pop your number in the chat. We've seen about 21. I think that's the most I've seen someone get caught up in, especially if you've got an email address you've had in a long time, you'll find it get caught up in a lot of different breaches. So the 3 I've got here, Kim's popped the links in the chat for you. We've got Canva, which is a graphic tool I use a lot. We have Mathway, which helping my niece with her maths, and Word with Friends, that game we all like to play. So it's really important that we actually keep an eye on these, do this regularly, check regularly to see what breaches that your email addresses might have been caught up in, because what we need to remember is that if your email address has been caught up in one of these breaches, they've got your password as well, 9 times out of 10. And one of the first things to do if you see any of these accounts have been compromised is that we should firstly go and change our passwords. Okay, that's one of the first and quickest and easiest steps that we can apply to protect ourselves. Because as soon as you change your password, then the cyber criminals who have access to the information no longer have access to those accounts. And a lot of us, we do the same thing. We keep the same username, password for lots of our different accounts. We do that because it's easy for us to remember. You know, it's really hard to remember all the different passwords that we need to have in our lives these days. So everyone does it, but it's not a safe practice, because if someone gets access to one username and password combination, then they potentially have access to other accounts that you might have access to. So I want to have a quick look at passwords now. And I would say here, who loves passwords? And most of you are probably going, no, Tracy, I really don't. You're looking at me quite strangely, but believe it or not, I love passwords. And I do love passwords because simply it is the only element of that security process that I can control. I cannot control how organizations set up their websites and their applications, and I can't control as a user what security they're applying to them, but I can ensure that I set up that strongest password that I possibly can to protect the information that belongs to me. So what makes a strong password? Well, I think most of us know by now that long is strong, and a lot of the sites that we use and a lot of apps we use now actually ensure that we do create longer and stronger passwords. They usually request that they contain uppercase, lowercase numbers, and those special characters. And we also want them to be something that can't be easily guessed. So things like our pets, our partners, or our children's names are not good elements to put in our password. And the main reason is because we share so much of this information on social media. So it is really, really easy for somebody to get access to that information, especially if we're not securing our accounts and making them more private. Okay, and importantly, they should be unique, like we said before, for each account, because this will prevent something known as a domino effect, which means when someone obtains or guesses a password for one account, then they can actually then gain access to any other account that uses that same password. So one of the latest techniques to creating strong passwords is a passphrase. So this is where it's recommended that you take 3 to 4 random words and you just put them together, okay? So we have some more complex versions of that. So we've got Somewhere Over the Rainbow and Cats and Dogs Love Sunshine. So there's some random words put together. And the beauty about this as well is that when you sprinkle in your complexity, so you add in your capital letters, you add in a number and a special character, then you just take a strong password and make it even stronger. Okay, this is, one final tip too is please don't write your passwords on Post-it notes and stick it to the screen. Any of you, I worked in hospitals for a very long time, and I had seen most of the system access to passwords just written on Post-it notes and stuck to the screen. You've essentially just allowed anyone to access your system. So please avoid that. I used to see it a lot where people would put post-it notes or write down all their passwords on the back of their ID badges as well. Again, usually your username is made up of your name, so you've got your username in the front and all your passwords on the back of your badges. And also avoid saving them in blank notepad labeled passwords that might be saved on the desktop of your computer, because if someone is in your systems, it could be targeted by hackers. So instead, we suggest you write hints rather than the actual password, or look at protecting them in password vaults. And while passwords really do help to protect against that unauthorized access, they can be cracked by malware known as password crackers and what we call a brute force attack. And this is why the application of multi-factor authentication, or MFA, actually provides that necessary added layer of protection in case your password is breached. And today, most accounts, so things like your MyGov and your banking apps, require MFA by default. But if you're not already using it, please consider setting it up on all the different accounts where it's offered. And you can use things like authenticator apps such as Microsoft Authenticator to generate one-time passcodes for you as well. And again, Kim has mentioned this several times today, and we're going to keep reiterating because it's so important, that another highly recommended step to protecting yourself from cyber attacks is to keep your devices and your software up to date. So ensuring you're running that latest operating environment version, because this is always a fix for any bugs or known security vulnerabilities. And a tip is to set automatic updates so these things just happen seamlessly for you, so you don't have to sit there and think about it all the time. And the next step is actually to back up important information on your devices. So a backup is simply a copy of your important file, so your photos, your videos, your documents. And instead of storing it all in one place, like we sometimes do, like just on our computer and phone, we often do that without storing them other places, you can keep a copy of everything somewhere safe. So having copies of your important data so you can successfully restore it if necessary is actually a protection measure for you. And this ensures that if something happens to your device, such as fire, flood, theft, loss, or even a malware attack, then you won't lose your important data and all those precious memories. And you can visit the Australian Cybersecurity Centre's website shown on the screen, and they actually have some really fantastic step-by-step guides on how to do these backups. So it's all there for you. And a final element of device security, and I think it's one we often overlook because it sounds so simple when we're talking about cybersecurity, is the physical security of our devices. And that is simply making sure we lock our screens when we walk away from them, and protect our devices when they're unattended. In another presentation that we actually delivered when we were discussing this particular topic, a clinician shared their story with us. And while they were actually working on a laptop by wheels by a child's bedside, and they needed to step outside to speak to the parents for a moment, and they actually left that device unlocked. And I'm sure you've seen this you know, in your time within different facilities and things like that. And when they actually returned in, they actually saw the child having a fantastic time. They were on the computer reading emails and browsing the web and having a great old time. And while this is a relatively harmless example, they didn't do any damage, we do need to keep in the habit of locking our devices to ensure no one can gain access or tamper with sensitive information. So if you're using a Windows device, which a lot of us do, we have a little poem. I'm sure you're going to love this. It's one of my favorite. Usually I do a dance when I was doing this in person, but sorry, just get me here up. So our little poem to help you remember is, to lock your screens is Alt Control Delete before you leave your seat, or Windows L X as well. I'll leave that one with you. I'm sure that will help you remember when you pop up, just lock your screen. Okay, so in this one of the last sections for today, we really wanted to provide you some tips on building what we call cyber resilience in your personal practice. So what is cyber resilience? It is simply that ability to be able to continuously deliver your services, okay, despite a cyber incident, event, or attack. And this little slide is to try and help tie everything back in together. So this is helping you to put an actionable strategy and plan in place for your practice, which will actually help protect your business from cyber threats, and most importantly, to recover as quickly as possible. So the following on the screen is a starting point. And these are some questions across some key areas that you should be asking yourself and your IT partners to help protect your business. So the first is, let's start with our people. So do they know how to respond if they've clicked on one of those links in one of those malicious emails? Okay, it happens to everybody at some point. Are they trained to recognize what these emails look like and also how to respond to a cyber attack if it actually happened? Does your practice have processes and policies in place in relation to cybersecurity? So do you have a plan for when something goes wrong? And most importantly, has it actually been tested to make sure it works? Again, we've said it over and over again, are your computers and laptops up to date? So are you guys maintaining regular backups of systems just in case something does go wrong? We suggest reviewing the Australian Cybersecurity Centre's Essential 8 strategy. So this is a baseline of strategies that will actually make it harder for cyber criminals to compromise systems and help organisations to respond to a cybersecurity incident. And we also suggest consider conducting a gap analysis to look at what you actually have in place, where you need to be, and how you can get there, okay? We really don't expect that you will know the answers to these questions today, but do consider having a look at the strategy and then setting up a meeting with your IT support team to discuss further. We also suggest taking a little bit of time to visit cyber.gov.au because here you can find out more about the Essential 8 and access many, many free resources that will actually help protect your business. So Kim just got that slide up on the screen now. Okay, the Australian Cybersecurity Centre, we've mentioned them again many times today, and that's because they're a great service. And they're also available to help any Australian, so all Australians who may be impacted by cyber incidents, whether it's through business or personal. So if you're working though at a state or a private facility, it will be important to follow their processes, okay, which will be most likely to report to your IT department. However, if you're working in a private practice or you're at home, then you can contact the Australian Cybersecurity Centre. This is a 24-hour, 7-day-a-week service on 1300 Cyber 1. So the number is on the screen there. And they are there to assist you to recover from a cyber incident. Okay, so it's important to know that as well as having access to the Australian cybersecurity, there are many resources available if you've been personally impacted. Last year, I was caught up in a couple of the major data breaches that occurred, which is quite concerning. So the Optus data breach was the first one where I had my identity stolen, my husband's identity was stolen as well, and then we got caught up in the Latitude one as well. So I've used ID Care through them. They're a fantastic service, and most of these agencies actually have a social media presence, and I strongly advise that you pop online and you follow them, because this is great on your social media sites, because if there are things that are happening, there's some scams they want you to know about, or the latest information about protecting your personal information, that they will push that information to you, so you don't have to always go looking for it. So I highly advise, and there are some other agencies you can see, ScamWatch and things like that, eSafety Commissioner, where you can go and find some fantastic resources. We have also created a fantastic resource within the agency, and this is free for anyone working in the healthcare industry. So this is our Digital Health Security Awareness course. It has been recently updated and was developed in consultation with representatives from a large range of healthcare settings and disciplines. And we have also Jenny, who introduced us, has just been recording some podcasts. So we will be releasing 2 new courses probably in a couple of months, I think, and they'll be on telehealth and cybersecurity considerations. And also working remotely is one of our other e-learning courses, and our podcast will be on data breaches and recovery plans, and also another one on telehealth and cybersecurity considerations. So please keep an eye on our website for those as well. Our team also often sends out alerts on the latest cyber threats to the healthcare organisation. So if you aren't currently receiving any of those alerts, please feel free to reach out to us, and we can add you to our mailing list for that as well. Okay, so just before we finish up, we wanted to quickly talk to you about the My Health Record system security. So it is important to know that security and privacy of the information that's held by our agency really is one of the most critical tenets in our role in delivering national health infrastructure and services. And our team works incredibly closely with the Australian Cybersecurity Centre, Australian Signals Directorate, along with many national and international partners. And what this does is allows us to maintain that visibility of that national and global threat environment. The agency's also implemented a wide range of security controls that help to protect that confidentiality, integrity, and availability of the My Health Record system. And this includes a range of security processes that actually limit access to the My Health Record system, and it ensures that any external software goes through a conformance process before it's allowed to connect. Also, as those of you who regularly use the My Health Record, you will know that in addition to these security controls, the system also has built-in security features designed to enable healthcare recipients, carers, and authorised personnel to monitor and control access to their own records. And if an incident was to occur, it's important to know that you would need to report this to the Office of the Information Commissioner, and the healthcare provider organisations are also required to provide assistance in relation to any inquiry or assessment in connection with the My Health Record system that might be conducted by the agency. And all of these steps ensure we're able to continue to keep that information in the My Health Records system safe and secure. And while we're doing our part to protect the integrity of the system, we're asking that you guys also have a responsibility to protect the system from unauthorised use and access. So what that means is any organisation that is registered with the My Health Record system must have a security and access policy, and that is regardless of the organisation size or how often they access the My Health Record system. Okay, now these policies are critical in supporting healthcare provider organisations to protect the sensitive information of their patients, and they also build staff awareness of the actual obligations under the My Health Record legislation. And at minimum, the policy needs to reasonably address things like how people are authorised to access the system, and how that access is actually deactivated or suspended if that circumstance arises. What training is provided to the employees before they access the system. Okay, also the process for identifying a person who requests access to a healthcare recipient's record. Okay, and the physical and information security measures taken by the providers and people accessing the My Health Record system. So, and any mitigation strategies to properly identify and act upon and report, and particularly report those cybersecurity risks. So to assist with this, there is a policy guidance template available from the link provided in this presentation, and it includes a policy requirements checklist. Okay, and like we said, there's also an e-learning course for developing a health record security and access policy for your organisation to assist in this process. Well, that brings us to the end. I really appreciate your time today. We really hope that you've enjoyed it. You've found some information fun and useful. And I will now invite any questions.
Thank you so much, Kim and Tracy, for your presentation. There was so many useful tips in there, and some really interesting content. I really, really hope that our attendees on the line leave today's webinar and head straight to their monitors and rip off those post-its with the passwords on them. I think that resonated so much with me, because I just know how common that is. So yeah, thank you so much for inviting us to speak. If there are any questions, if people can pop them in the chat, we still have a couple more minutes on the line, and are happy to address any questions from anyone on the line. I know Tracy and Kim, you've been chatting for quite some time in today's session, so I was wondering maybe if Danielle, you wouldn't mind responding to a question, and whilst people are thinking about questions and popping them in the chat, do you mind kind of summarizing to us and giving some tips to healthcare providers? How can they protect their clinical information systems? What is it that they can easily do?
No, with the threat environment, I'm sure every day we keep seeing how cyber attacks are becoming complex, they're more sophisticated. the threat landscape is changing so much that it's putting us against creative and well-funded threat actors. And also there's this increasing complexity of the different environments that we're managing at this point. Kim said this, I think, quite a few times. The healthcare industry is a top target for ransomware attacks. And I think the one thing that we could probably look at is it's a gold mine of data, and most of it is because there's easily exploited legacy IT systems that are being used. Perhaps one thing to do is to start looking at looking at your cyber hygiene that is within your practice, within your organization, looking at how better you could enforce perhaps better email practices, increasing awareness about cyber threats in your organization, then having a chat with your IT service provider about how you can start to build better controls around your IT systems, backups, better resilience plans for you to be prepared for the future.
Thank you. I'll read out a couple other questions or comments that have been posted in the chat. One is from someone saying that their Google account was taken by an ex-employee, and they're not sure, I think, what to do with that. Any advice or thoughts on that? Maybe Tracy or Kim, if you've heard of that.
No, I haven't heard of this. Danny, have you heard of this?
So just the question, I'm guessing someone has probably stolen their identity. And I'm not sure about website sabotage, but I think just basically if they've taken your account, then the only way possible is for you to lodge a complaint with Google for that. I do know that Google do take quite a long time to verify that. But in order to prevent this from taking place in the future is to ensure that you've got, like Tracy and Kim said, having that multi-factor authentication set up, which makes it harder for people to sort of take over your account or, in that case, steal your identity. But in this case, unfortunately, the only way that you could recover your account is via Google, and the process takes quite a long time.
That's handy advice.
Well.
Sorry, Kim?
Sorry, I was just going to add first, sorry that you've had to experience that. That's not nice at all. But another way to help avoid this in future is having a trusted secondary contact or recovery account. So have another backup account of your own that you trust, that say that if that account was compromised, you can refer back to that. And you can do that with a lot of accounts, even social media as well. Always having a trusted sort of backup account.
That's a good tip as well. What is cybersecurity insurance? Who wants to take the question?
Sorry, I was trying to unmute myself there before I answered. So basically, cyber insurance just covers the risk of losses that may take place from cyber attacks. And for example, some plans, they may have coverage for physical damage to hardware, or just coverage for income that you may lose when your business systems are down. Again, I'm not an expert in cyber insurance. Do you need cyber insurance? I think this is something that you could possibly discuss with your, probably with, I think more from a finance perspective, also discuss with your IT service provider, because I think it has to be taken on a risk-based decision. This is a risk-based decision that you would need to take. If there's an increase in risk for your business to operate, then obviously that decision has to be made with your IT service provider.
Thank you for explaining that to us. All right. Well, we're nearing the end of today's session. I have just popped a link in the chat as well to our evaluation survey. Not a phishing or a scam link by any means. If you'd like to leave some feedback or leave a question to us, please feel free to submit that via the form, and we should be able to get back to you if you leave your contact details in there. Otherwise, I really hope that you found the session useful. Thank you so much, Renata, and to the Darling Downs and Westmorton PHN for organising the session today, and to all of our speakers, Tracy, Danielle and Kim, for sharing all of those tips with us today.
Thank you very much for a very super informative presentation, team.
Thank you, and have a